Hello, this is Dr Helen Weatherly. Welcome to our GenderGP podcast, where we will be discussing some of the issues affecting the trans and non-binary community in the world today, together with my co-host, Marianne Oakes, a trans woman herself and our head of therapies. So we have Dr. Laurie Beth Bisbey. She's a psychologist and a sex and intimacy coach. And we have DK Green of dkgreen.com. So Laurie, can I hand over to you to just tell all of our listeners who you are, what you do, and also who you brought with you today.
Right. So I'm a psychologist who has 33 years experience now working with people to help them create and maintain meaningful relationships that also contain sizzling sex. I have a specialty in gender, sex, and relationship diversity, and also in the treatment of trauma. And I'm here with DK Green. And DK, why don't you introduce you, please?
Will do. Hi, everybody. I'm DK Green. I'm a psychotherapist, private practice with a phenomenal number of clients. And it is solely GSRD. So all of my clients are gender, sex, or relationship diversities. So they're either LGBTQIA+, or poly, or kinky, or a combination thereof. I work with a vast amount of trans folk, and I myself am a trans man.
Brilliant. Well, really, really lovely to have you both. That's exciting, Marianne, isn't it? I can't wait to get going. I don't know about you.
I feel slightly intimidated. I'm not going to lie.
I think we'll let them do the talking, shall we, Marianne? Yeah, we'll let them do the talking, I think. Okay, well, first obvious question, Laurie Beth. Sizzling sex. You need to expand on that. Come on, that's something that sounds so exciting.
So for me, sizzling sex is whatever it is that really brings you pleasure. And a lot of the people I see have a lot of shame. So I spend a lot of my time working around helping people get rid of shame and helping people to recognize that they all have a right to pleasure and their identify desires and then move forward. So sizzling sex is whatever gets you off.
Brilliant. Okay. So just a couple of sad words came out when you were introducing yourselves, and just then. So there was the word trauma, which Marianne and I have talked a lot about in the past, and I know something that Marianne feels very, very strongly about. And then also shame, and it is a shame that those two words have featured so prominently so early in our discussion. I mean, perhaps we could kind of get over that bit, and then we can move on to the happy stuff, if you know what I mean.
That sounds grand.
So why the trauma? Why the shame?
And so for me, my original specialty was trauma, PTSD treatment, and I did a lot of sexual violence work. I experienced sexual violence myself. So I started working with people on getting over that and getting over the symptoms, but they were often left with no PTSD symptoms, but an inability to enjoy sex and an inability to get back into sex. And that was a separate piece. And there was a lot of shame around that. And particularly with GSRD clients, anything that is non-heteronormative, that's seen as out of the mainstream, because of the amount of pressure and bombardment and othering, people experience trauma.
I agree. I'd like to chip in there if that's okay. So obviously, by the time people come to me as a psychotherapist, they're struggling. They're in a position where they're having challenges and struggles, and a lot of that relates to trauma as well. It's very, very common. It's the uppermost presenting issue when somebody comes into my room is any trauma that they have dealt with. The shame around sex, since this episode is around trans folks specifically, it's deeply rooted. As Laurie was saying, the structural systemic societal expectations that we are raised with around sex, around heteronormative sex, leaves people, the othered people, anyone of any kind of diversity, feeling deeply ashamed that they don't fit into that nice, neat box, whether that's because of their sexuality or because of their gender, which of course are two different things and often not related. So I think in the therapy room, it's really important to work with, the traumas that they've presented with, and often that is for a trans person around their transition experience, not necessarily because they're trans, but because of society's treatment of them as trans, because of families, because of friends, because of society in general, and that discrimination and that othering, and that rejection. So those are the sorts of traumas that we deal with around trans issues, and the shame comes from not fitting into the gender normative box.
So, I mean, the concept of othering isn't something that I've come across very much, actually. So what I'm hearing you say is that society expects us to be like everybody else, just like this. And if you're not like this, then you are an other, and therefore that causes difficulties, and the shame, internal shame of not being that perfect person, but being an other person.
That's right.
That's made me feel quite sad.
It is. It's a very sad experience. And to be frank, anyone of any diversity has that experience. Anyone of any different race or colour, anyone of any different body physicality diversities, any neurodiversities, anyone of any kind of other than, cisnormative, heteronormative, etc., it has that lived experience of feeling othered by society.
And often they have it from their families as well, which is the hard part. Because then they internalize it, and when they internalize it, they do it to themselves.
Yes. Yeah.
What do you mean by that? I'm going to push you on that one. What does that mean?
Go for it. Go for it. So we learn about ourselves and about how we should view ourselves from our caregivers and from the people in our closest environment when we're growing up. And if they reflect negative things to us, if they tell us that we're not normal and we're different than we should be, after a while, we begin to believe that. So it's a form of gaslighting. We trust them because that's the only kind of place we have to go to learn. And that starts from birth.
Yeah, a really good example, sticking with the topic that we're with, which is trans folk, is that 99 out of 100 trans people have internalized transphobia. We don't have a problem with being trans. We have a problem with the rest of the world perceiving us as trans and that being othered and wrong. So I think the internalized transphobia is, if you're told from birth and shown in media and in everything, kind of bombardment was a great word you used earlier, Laurie, that being trans is somehow wrong, then on some level you will internalize that. It's like internalized homophobia, internalized transphobia. We have to live with that and constantly debate and argue and rationalize with ourselves that we know this is internalized transphobia. It isn't truth, it isn't reality, but it doesn't change how you feel. And that's often what brings the shame.
And that's something that you can work with in therapy.
Yes.
You first have to know that it's there. You first have to realize that the information that you've taken in is not true for you. It's not your truth. It's the truth of the people around you.
So basically what you're saying again is that the people who are supposed to care for you from the minute you were born, if they are perceiving that you are an other, a different, something that's not normal or right, then you can't help it, but it comes across to you and you bring it in and either start believing it yourself or have to keep fighting that thing within you. Is that right?
Absolutely.
Yeah.
So you think about it this way, that by the age of 2, most kids know that they have value. If they're in a good family home, they know that they have value, and then they know that they're loved. And that's the basis that you have as a person for knowing that you are worthy of love for the rest of your life. So if you have poor parenting from birth or early life trauma, you don't learn that. And if you don't learn that, that's something that follows you. This constant feeling of not being good enough, not being lovable, and brings a lot of people into therapy. So it's early life parenting, birth to age 6, is crucial. Crucial.
Marion, you were wanting to say something.
I was just going to jump in just to kind of expand that a little bit. An experience, I get people really at the start of the journeys, long before they're even thinking about talking about sex, although it's always prevalent within the therapy room. But a lot of for example, the trans boys will experience the mother trying to make them wear a dress, and they always talk about the anger and the atmosphere that it caused within the house because the parents were trying to normalize that child because the parents didn't want another. And, and they're not doing it, the parents don't even know they're doing it wrong, but the problems that causes as they grow in self-acceptance. And I hear it all the time, more from the trans boys, because it tends to be more prevalent with the trans boys in early childhood, is that the fight that they have to be heard.
I mean, I do see quite a lot of parents seeking help. And for the young children, I hadn't really realized that there were more trans boys than trans girls, actually quite a large percentage. And lots of them are actually coming in not having forced a child into the dress now, because there's more publicity, and coming in and saying, I don't know what to do, but I don't want to do the wrong thing.
If I can just add, there is an issue there that the underlying issue is that those assigned male at birth are pretty much left to be themselves, whereas those who are assigned female at birth are awfully sexualized, awfully stereotyped. You must wear dresses, you must have your hair pretty, it must be pretty to be normalized. So actually the pressure on young trans men is to be conforming to this idea of the pretty girl, whereas the pressure on young trans women is slightly less in that sexualized manner. It's actually, just boys walk with boys, leave them to it. It's only later when trans women are starting to be forced into this masculinity bullshit that's when their emotional stuff really starts to trouble them. Yeah, so I think that's why it's more prevalent in the trans boys, as you use the term. Because they've had that, the socialization of being forced into pretty. Yeah.
And I don't think that's changed all that drastically.
No, not in. You only have to look at the toy shelves. Yeah. Everything is still blue and pink. Yeah.
So that's interesting because we kind of we've identified that early childhood and being a parent's really hard, isn't it, to get it right? Really hard. We just want our kids to be happy. We just want them to have a normal life, and it's really hard, isn't it? But even that what is normal, and Laurie Beth, when you were saying earlier about the diversity that we have so much diversity, so much, and it's like, well, how can we in this society have this one white heterosexual cisgender normal thing? But we can't unpick that at the moment. But going back, so really, really important that parents give their children space to breathe, and we understand that. We've got to let them explore themselves, their identity, who they are and how they fit in. Really important. And then DK, you were talking about the excuse me. And then DK, you were talking about the transition experience, which I'm guessing is where Marianne kind of comes in quite a lot. So Marianne's seeing people as they're starting or progressing through their transition. And you mentioned the transition experience as being not a problem, an issue. So what was that?
It's a fight for anyone whose otherness is invisible. So if you are physically visibly disabled, it's easy for people to see that. If your disability is invisible, it's really different. It's a very different kettle of fish. So transgender is initially a very invisible state to be in. So it takes a literal coming out. In the same way as an invisible disability, you have to tell people, I can't do that because XYZ. So that coming out process puts you in an incredibly vulnerable place because you're literally telling people, yes, I'm other. I'm different to you. I'm not going to fit into your boxes. And that is scary. It's vulnerable. A good example of that is my youngest. I've got multiple kids and grandkids because I'm a lot older than I look, but my youngest is the only gender variant among them, and they live in a completely queer household with a trans woman, a trans man, and a non-binary butch. Okay, that's their life. That's the way they were raised, with whatever is okay by you. If you want to be a polka dot Martian, that's okay by me. If you want to be, Christian, heterosexual, that's also okay by me. They were raised literally in an open environment. But because of, sorry, the sun's blinding me, because of society's expectations and that constant media message from the word go, the socialization still had its effect. They were terrified to tell me. Even when your parents get it right, it's still societal pressures that make it really hard. So
Absolutely.
I think transition...
Well, I was going to say, even when the parents do get it right, the children have still got to go out into the world.
Yes.
I'm not going to say the world is wrong, but it's, they are othered in the world, and whether... And even if, because I'm sure it's the same in other cultures where people feel othered, that when the children go out into the world, they work hard to fit into that world. And it becomes almost habitual that actually stopping that process can be really difficult as well. So no matter what the parents do, it's what goes on beyond the family environment.
And to add to that, especially school, kids are cruel. And the drive and the pressure to fit in at school and not be othered, because othered equals bullying.
Yeah,
so the drive to be, fitting in at school, the pressure there is almost harder than from parental.
What I want to do is give some positivity as well to the people who will be listening, because we are learning all the time, aren't we? As professionals, we're learning all the time. As society, we're learning all the time. And children and adults and adolescents and parents are learning all the time. And so, yes, the school playground is a cruel place. But equally, we are seeing the young people being much more accepting than today's adults. They get it. They're like, I don't care what colour your hair is. I don't care what you've got down there or under there.
I think that transition in itself happens around sort of teenagehood. I think young children are very pressured because they've got the child developmental brain, which is just accepting fact and information and input. And it's not until they hit cognitive faculty somewhere between 9 and 12 that they actually start to question and discern for themselves. So by the time they hit teenagehood, they're like, right, I've got my questions about this societal script. It doesn't fit me.
Yeah. Absolutely. So, Marianne, you were excited about the sizzling sex, but when I came onto this podcast, I was thinking, okay, so I was just contemplating trans people and what challenges or barriers or difficulties they might have, and I was just simply imagining the kind of physical difficulties or concerns or worries. But actually, what you've both taught me is that in order to have that sizzling sex that we all see and want, you've got to start loving yourself first and understanding that it's something that, yes, you can have it, and yes, you deserve it, and yes, everyone can have it. Am I right?
Absolutely. I mean, for me, the thing is that if you identify your desires, you love yourself, you get comfortable with yourself, you gain confidence, and confidence is sexy as hell.
Absolutely.
Right?
And it's about giving yourself permission, because if you've been othered and shamed, it's really hard to give yourself permission and say, yes, damn it, I can have this. I can enjoy this. I can choose what I want for pleasure in my life.
So if we've got people listening who haven't, are just kind of not quite there yet, or, what could we help them? I mean, I know they're not in the therapy room at the moment, and that's a different place. But can we help people who might be listening who are kind of understanding what we mean here?
Yeah, I think I'd like to add, because I see a lot of clients through transition, I think it's really important that there's no rush, there's no hurry, and actually to do things as and when you feel ready to do them. And that does involve a lot of the early work around shame and around othering and so on. But actually, then you can start talking about, well, what do you like? What would you like? What's your fantasies about? When you masturbate, what is it that you're desiring? Who is it that you're desiring? What gender? What sexuality? Those are the questions that we can start to ask. But those things can be very fluid, especially through transition. People have literally changed their sexuality during transition. So, that can be a whole journey all of its own. But I think the key thing that I want to say is absolutely give it time, because you'll rediscover, because it is new, especially if you go down the physical transition route. Hormonally it has big effects as well on libido and all the rest of it, but actually the physical transition it's almost like starting all over again, even if you had a super fantastic sex life beforehand. It's kind of like rediscovering what your sexual tics are. Yeah.
I would just reiterate the same thing. Take your time. I talk with people about masturbation as something that is usually something for many people that's quick, and it's it's an effort to relieve pressure. It's not even about pleasure for lots of people, but that one of the ways of figuring things out is to really take time with yourself. So, look at erotica, listen to erotica, explore your body, take your time, go slowly, get comfortable, and actually set time aside to do that as and when you're ready. So, and treat it like a gift. It's a new exploration. You get to do a lot of things all over again. You can just throw all your assumptions out the window. And start from scratch.
And also because of trans folk, there's often, not always, but there's sometimes a real discomfort with sex when your body doesn't fit who you are. It doesn't, map out the way it does in your brain. So there can be a discomfort with sex beforehand that actually suddenly becomes this super exciting thing that's full of possibility. But it can also be that you had a great sex life before and now you've got to figure it out all over again, and that can be quite challenging. Yeah. So finding what you like is a journey and a process.
Marianne, when you're going to be in your therapy room over the next few months, do you think this is helpful to understand?
I'll tell you the challenge. I'm obviously not a sex therapist, but the challenge that I have, and I think it's linked to what I've learned through the trans community over the years, is there's a lot of people think that wanting sex, certainly for trans women, wanting sex and enjoying sex invalidates us as women, because apparently somewhere they've been taught that women don't like sex. So getting them to realise, I can see you shaking your head.
It's bad enough having to do that with cisgendered women.
Yeah.
Having to go through the process of saying, actually, you're built for pleasure. Right?
Yeah.
So, what I was going to say, so I sit there with people, and the way they talk about sex and the way they introduce it into the therapy room is awkward. It's disturbing to hear. It's disturbing for them, and it's not unusual for me to hear people refer to masturbation as body abuse. Wow. Because they see it as a bad thing, and they can't just enjoy it.
That's a shame.
Struggle to compute that in my own mind, but I have to sit with it, if you know what I mean.
Yeah.
I'm not going to go and argue with them.
It's the shame, and it's the shame that needs to be worked on in that particular case.
God, that's so hard.
Oh, I also wanted to mention, I think really important in this particular conversation is language. Language is so important, so important for trans folk. And you'll get as many different opinions of what language they need to hear as there are different people. Quite literally, I've heard trans men talk about their front hole and their back hole. I've heard trans men talk about their dick. Some talk about their clit dick. I've heard trans women talk about their girl penis. I've heard trans women who don't want to talk about it at all, like would rather it didn't exist. So the language is so important. And if I'd like to give a bit of advice to anyone who's listening who wants to have sex with a trans person, their language is what matters. So you need to find out what language they want.
Yeah, before you speak, find out what language is.
Yeah.
And also, I'm guessing, and I'm going to guess here because I don't know, but I'm guessing kind of like if a trans feminine person wants to use their penis in sex, that is absolutely okay, no problem at all. That doesn't mean that you're any less of a woman. And I kind of want to say that to anyone who might be listening. Use any part of your body that gives you pleasure.
I'm really happy to hear that. Really happy to hear that.
I just kind of to expand on that, and I don't know what everybody would feel, but it's find ways to get pleasure from it. It doesn't just have to be, one-dimensional, shall we
Yes.
say.
Absolutely.
Explore your body. And the biggest concern I have as a trans woman or as a trans person is that a lot of regret around surgery, for example, is because they felt pressured to have that surgery because of the shame, not because it was right or an enhancement of their femininity. Does that make sense? That they go through it because they think this is going to make me happy now, because that's what the community, the trans community expects of me. It's what the medical community expects of me. It's what society expects, but it's not necessarily what they expected of themselves.
And I don't think they go, and I'm not sure if they always go through it with good information on what that means for pleasure afterwards.
Correct. I think there is a lot of those conversations in my therapy room. There are a lot of those conversations. But I think equally there is, there probably are more conversations about people who are fearful of having surgery for those very reasons, for loss of pleasure, for the surgery itself. It's a traumatic experience, for the repercussions and the healing and the time off work and all the rest of it. A lot of people will put it off and put it off and put it off. So I think it's not just the fact that some are feeling pressured by society to have the surgery to fit finally into one box or another, but also it's about working with those pressures to actually find out what that individual person feels, wants, needs for themselves, irrespective of society's pressures, either way.
So we had a question on our last podcast from somebody that I'm not sure we gave it justice, because I don't know the answer, and I guess we don't know the answer because the answers lie within that person. But so somebody had put a question into us that they'd had surgery. She was a trans feminine person who'd had lower surgery and had no feeling down below afterwards, or less feeling than she was hoping to have, but which translated to her as no feeling. And I felt quite impotent in helping her, if you know what I mean, which is obviously coming from her own feelings as well. But that must be horrible, and I'm going to give it to you because I didn't know what to do with it.
So there's a couple of things that I want to talk about there. One is the surgery I've had clients who transitioned sort of 20, 30 years ago. The surgery is much improved now and it's getting better all the time. But I do have people whose surgeries were bad, were poor, who do have that struggle. So firstly, for anyone who's newly transitioning, I would encourage them to do as much research as they can about the particular surgeon they want and the results that they've had, to ensure the best possible result. And for those who've already had surgeries and are feeling diminished in their sexual pleasure, there are a million ways to have sex. And that's what I would be talking to them about. I would be talking to them about Tantra. I'd be talking to them about, the sort of the goal set of sex, of you do this and tick, boom, and it's over. I'd wipe that off the table and look at all the different ways that you can have tremendous sexual pleasure that aren't about, tab A goes into slot B and hey presto, you're done. Yeah, so that would be my approach.
Different parts of your body, sensitivity in different parts of your body. And so looking at bringing out the sensuousness and the erogeneousness of various areas of your body. It's similar advice that you would give to somebody who's had spinal injury. Mm-hmm. Yeah. So move the source of pleasure. And it's going to take time and it takes effort and discovery, but tremendous pleasure can be had.
Go Marianne.
I was just say, can I ask the thoughts, because something that I've kind of learned through doing the podcast with various people, but also talking to people that have gone through surgery, is because of the nature of gatekeeping, we try to fit a particular narrative. And we go all the way through this transition trying to fit this narrative if we're hitting gatekeepers. And by the time we get to a surgeon that's just about to do a vaginoplasty or a phalloplasty, that we're frightened to talk about sex. The most important thing, or not the most, but equally important thing somebody should be asking somebody about to go through that: what do you want it for? How are you going to use it? How much pleasure do you want? Yeah, I don't think... my understanding is that conversation's never had. It's all about, it's going to look great. It's going to make you feel more like a man or a woman, but actually, will it function? Do you know?
Yeah, I mean, which misses at one of the biggest points, because you want to be a functional man or woman. You don't want to be a doll, right?
Yes.
So, and it's sad that conversation doesn't happen, but it's not surprising.
Yeah, interestingly, it does happen with the top surgery, at least in my experience. So, you know, you essentially sign a disclaimer that if you're going to have nipple grafts, then hey presto, you're not going to feel anything. Yeah. Or you're most likely not. Now, for example, I had 2 nipple grafts, obviously, there are 2. And one I have really, really great sensation in, which is bizarre. And the other, I don't have much. I know people who've had all sorts of top surgery who've had those conversations with their surgeon. And yet when it comes to lower surgeries, pleasure or function is talked about. Do you need to be able to pee through it? Do you need to be able to penetrate? Blah, 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 you know, function. But nobody talks about pleasure.
But then that's not just here. I mean, they don't talk about pleasure. If you go to the gynecologist, you know, as a woman, nobody talks about pleasure there either, unless you bring it up. It's the last thing on the menu.
Yeah, I think, Marianne, that is because of what you said earlier, wasn't it? You know, when someone says something difficult, the easiest thing to do is just either pretend you didn't hear it or get over that as quickly as possible. Yeah. And Marianne, you talked about the gatekeeping again, and it really distresses me when, you know, the criteria for surgery are 2 letters: to show that you are trans enough, and to show that you're not going to regret your surgery, and to make sure you understand what that surgery is all about. And you're right, there's nothing in there, is there, Marianne, about what you want? Why do you need it? Why do you want it? And what do you want to achieve? And also, what are you going to miss after the surgery? Because they're going to change some bits around. So what are you going to miss? You know, do you want to hang on to that bit? Because you might like that bit, actually.
And that's a conversation that absolutely should be had. I mean, it's distressing that it isn't had more often.
There's something I've talked about, and this is, again, it's purely experience and nothing academic about this at all. But to me, libido isn't just about having sex. It can be the difference between having a fantastic social interaction. You know, it can be energy in a room, in an office environment. It puts a tension in the air that is exciting, that drives people, it helps ambition. And actually, if we see sex drive or libido purely for gaining sex, energy's being lost out of the world, out of our lives.
So I talk about this all the time. When I talk to because I sometimes talk on business summits and things, and I talk about the fact that if you you access your sexual energy and you integrate that, and you're authentic, so you know what your desires, and you have no shame, and you're feeling comfortable, that in business on a stage comes through, and you come through as confident, and there's all sorts of energy, and you've got the motivation to do the things you want to do. If you don't, there's a gap and a stop. It's just like when somebody's in the middle of a divorce, for example, you can see that their concentration is off. You can see that something isn't quite right. And it's the same thing. So libido, I look at it in the old-fashioned way, which is that energy is necessary for all of life, not just sex. So absolutely agree with you.
I'd really like to end with, I know I recognize we're running low on time, with something semi-positive. So we talked, going back to what Marianne said earlier, about those conversations that aren't being had. So my experience in my profession and with my clients and with my work that I do with the GICs, there are 7 UK GICs. They vary massively, and some of them are absolutely stuck in their Dr. Mooney ways of, you have to tick this box, and this box before we'll allow. So that's the gatekeeping stuff. But some of the GCs are actually waking up, and they're getting more clued in about gender. They're exploring the fact that actually gender isn't binary, that there's lots of fluidity in between that. Some people might want this and this, but not that. It needs to be a smorgasbord to fit the individual, not, you know, your tick boxes that you have to achieve. Yeah. So I think it's really worth mentioning that some of the GICs are waking up and are listening. And there's an awful lot of advocacy and fighting going on to make that happen. So, I don't believe it's great right now. I do believe it's getting better. And my hope is that enough people are going to fight, enough voices are going to be heard, that actually they do change these things.
Yeah, that's a beautifully positive thing, isn't Marianne, isn't it?
I was just kind of not wanting to bring the conversation down. I don't know why this just came into my head. I was at the doctor's yesterday, and he said to me, how are you getting on? I'd gone for my injection and just checking how I was getting on. Never once has anybody through the GIC or at the GP practice ever asked how my libido is and am I happy. And I think we had a small conversation when we were away the other week, didn't we, Helen? And I said that, it would be nice to have some education around that and, maybe be able to talk to the doctors and maybe give me a little bit of testosterone. But the fact that he wouldn't mention it, I think I mirrored it. If he's going to be awkward, I'm going to be awkward. Sometimes we need the professional to bring this into the room.
Absolutely. And unfortunately, this is semi-universal. I had a hysterectomy in 2018 and they took my ovaries. And I'm educated. So I said to the gynecologist, I want testosterone, please. Because with no testosterone, I would have no energy and no libido. So not only do I want estrogen, but can I please have the testosterone? And he said, fine, I am going to give you a prescription. We'll see if you can get it on the NHS, but it's highly unlikely. And I discovered that unless you are under the age of 40 and have a hysterectomy in most places in the United Kingdom, or you're transitioning, you cannot get testosterone if you are in a female body. So if you're over
because the libido is not medically important.
That's right. After the age of 40, if you don't have libido, it's not a problem. So you have to pay for it yourself.
And I think this is really important because we haven't really touched on it. So we've touched a lot on the psychology of sex and the brain. I always say, when I was working in the psychosexual field, that the brain is your biggest sexual organ. Without that working properly, nothing can really go well. So brain really, really important. Finding your where on your body feels good for you, really, really important. But actually, those hormones are really important too. So that is a kind of a very physical thing. The other is a very psychological way of looking at it medically. Yeah. And then we've got the physical thing. Hormones do matter. And, yes, we all need a little bit of testosterone. And that's really important. And if it's just for sex, and I've got my fingers in inverted commas here, then that's okay. That's fine. But just for sex, in inverted commas, is absolutely fine. And then the other thing that we see a lot is trans feminine people, for example, so excited about switching their hormones, feels so good, and they're given medication to completely get rid of their testosterone. Hooray, hooray, hooray. And the estrogen feels amazing and lovely, really beautiful, but something's missing. That little tiny bit of testosterone is missing, because what medically we've done is get rid of all of it. Right. And it's a really important discussion, Marianne. You're so right, that needs to be had with a doctor that understands hormones and understands that sex is important. And their recognition for the bedside manner part of it is that if they don't bring it up, their patients are going to have trouble bringing it up, and they're doing them a disservice. They have to be able to be comfortable. It's the same when you go to see a therapist. When we talk about this, so the therapists who are not used to dealing with GSRD clients, who you can see on their face how awkward they are and how uncomfortable they are, and every emotion that they're having, the client's not going to talk. But
I also want to say that actually that's what's happening at the moment is people, because the doctors aren't talking about it, the GICs aren't talking about it, the clinics aren't talking about it, they're coming to see sex therapists, they're coming to be psychologists or therapists who are educated about sex, because they're desperate for someone to talk to and say, this is a problem, I need help with it,
I feel like we need two posters in our rooms. All people welcome here. So these list of diversities of people welcome here, infinity diversities, and these are the things that you can talk to me about in here, and infinity number of words. And it's kind of like, okay, so both lists have got infinity on them, so we don't really need the list, because everybody welcome, and we can talk about anything. I mean, that would be a really lovely position to be in, wouldn't it? I think we could talk forever, and I wish we could, but we have to, like all good sizzling sex, it has to come to an end at some point. Time. Unfortunately, until the next time. But I have learned so much. I can't wait to go out there with my libido into the world, with my confidence and energy in everything. You've really inspired me today. I don't know about you, Marianne.
I've just enjoyed this whole series, but actually this today has been really enlightening, and I felt really comfortable talking about sex.
Really glad. Yes.
Yay! Thank you so much to both of you for joining us. Thank you.
Pleasure.
Thank you. Thank you, Helen.
Really,
Thank
really
you, Marianne.
Thanks very much.
Thank you,
Bye.
Bye.
Thank you so much for listening. I really hope you've enjoyed our programme today. Please go ahead and subscribe to future episodes if you haven't done so already. If you or anyone else have been affected by any of the things that we've talked about in our podcast today and you'd like to contact us, please visit our website Help Centre and contact us via there. We're very happy to accept ideas for future episodes and future guests, so let us know if there's anything specific you'd like us to cover. You can also visit our website GenderGP.com for a multitude of information about transgender health and wellbeing issues. You can follow us on social media. ID is @GenderGP, and you can sign up to our monthly newsletter. Full details can be found in our show notes on our podcast page. Thanks for listening, and see you soon.